Welcome back, colleagues, and I really hope that each of you found the concurrent sessions that you attended to be useful. And I want to take this opportunity to quickly summarize some of the key learnings, as all of you had to make the difficult choice in only attending one. An additional benefit of recording these sessions are that they can be available on demand at any time. So you will still have time and opportunity to view each and every session that was held today. The antenatal corticosteroid session focused on resolving the controversies about the efficacy and safety of antenatal corticosteroids when used in pregnant women in imminent risk of preterm birth. Panelists were all country principal investigators for the WHO Action Eye trial, a mix of maternal and newborn health experts who had shared their contextual experiences from the trial implementation and their implications for individual countries and other low resource settings. This important study has contributed greatly to the global evidence base and highlights the important take-home message that a single course of ACS given to women at risk of delivering prematurely reduces the risk of serious respiratory illnesses and death in neonates in low-middle income countries. Professor Shabina Arif said it very simply. Antenatal corticosteroids are safe, are useful, and can save newborn lives, and we can achieve the SDGs as this one intervention that has not been tapped. In the session focused on improving experience of healthcare and mistreatment of women during birth and newborns, we heard how unfortunate yet common it is for mistreatment to occur. Our opening video shared the alarming statistics that as many as 2 in 5 women experience stigma and discrimination during childbirth. And this key aspect of poor quality of care is deterrent for women in seeking facility-based care, and it has serious implications on human rights. Hopefully, all of you in that session gained new knowledge on strategies to inform policy and program decisions for countries at all income levels. As Dr. Sachs pointed out in her remarks, many of the abusive practices occurring are not due to poor intentions of providers, but to outdated training and practices. We know that the network of improving quality of care for maternal, newborn, and child health is a broad-based partnership for committed governments, implementation partners, and funding agencies working to deliver the vision that every pregnant woman and newborn receives good quality care with equity and dignity. And during the last 4 years, the countries that are part of the QOC network have developed national guidelines on quality of care, adopted the WHO's standards for improving quality of maternal and newborn care in health facilities, implemented at the district and facility levels initiatives, learning activities aiming to enhance maternal and newborn health outcomes, and continued to monitor progress. This session highlighted learning from implementation of the QOC network activities that are critical for scaling up and sustaining implementation of quality M&H interventions, and participants work together to identify critical questions that must be prioritized by the QAC national forums of the network countries to contribute towards global learning and knowledge development on scaling up quality care for M&H. From Guatemala and Nigeria to Ghana and Bangladesh and more, we have been around the world today hearing about solutions and discussing emerging evidence, how data is being used to track progress and inform action, country experiences, implementation successes and ongoing challenges, the importance of focusing on equity and equality, and promising solutions to accelerate progress towards targets in maternal and newborn health. Nearly 2,000 of you answered the call to join us for this opening forum from over 100 countries. We started our day with a challenge from Queen to push boundaries, to be uncomfortable in our demand for collective action. We saw from the data presented today that we have achieved a lot over the past several decades, but it is not enough. We can and must do much more in order to accelerate progress. And the only way to do that is to act together. Thank you, friends and colleagues, for joining us. Thank you for thinking outside the box and answering the call to listen, learn, and act. And I want to encourage you to check out our networking opportunities and meet with panelists from the ACS and the QOC concurrent sessions. And tomorrow at 7 a.m. EDT and 11 a.m. GMT for a special networking session hosted by the core group for all of you young professionals out there as they welcome future innovators of global community health and international development. Please click on the agenda tab to find your way to the networking rooms. Tomorrow promises to be another exciting day. We will be led by Dr. Aparajati Kokoi, the Executive Director of the Center for Catalyzing Change in India, my fellow steering committee colleague and your day 2 moderator. I wish to see you all tomorrow as we continue our fruitful conversations. And remember, starting right now are our exciting networking sessions. We look forward to seeing you there and also in the morning starting at 7 a.m. EDT.